Hi, today we're going to be talking about amyotrophic lateral sclerosis or ALS or Lou Gehrig disease. This is a very rare disease. However, some of my followers asked me to talk about it. Therefore, I'm putting out this video about this disease ALS. So the clinical picture of ALS patients presents with weakness, typically is asymmetric weakness. It could be in the arms, in the legs. It starts with one side, it can move to other sides. At times you have what's called fasciculations, where the involuntary movement of muscles, especially the tongue muscle. At times you have involvement of the tongue, so you're going to have difficulty with speech and talking. Now, the symptoms or the weakness is going to progress, and when it progresses, it's going to involve the swallowing muscles, and therefore the patient will have swallowing difficulty. It can also progress to involve the respiratory muscles, and therefore they'll have difficulty with breathing. So the cause for this disease is unknown. We don't know the cause of it. However, there is a genetic component, that there are some genes that are identified that link to this disease. Now, the diagnosis is based on the clinical history of the symptoms, is based on the clinical examinations. We do particular exams as a neurologist that can lead us to this diagnosis. The neurologist will order some testing like blood testing. They might order an MRI of the spinal cord, or they might order an MRI of the brain to rule out other causes that might be contributing to the symptoms. However, the test that helps us the most is nerve conduction test and EMG. We do a thorough nerve conduction test and EMG for all extremities. We do EMG of the tongue and the paraspinal muscles. And out of all those tests, this test is the one that will help us with the diagnosis. It does not 100% confirm the diagnosis, but it gives us good comfort level that this is the diagnosis that we are dealing with. Now, for the treatment, there is really no cure for this disease, and this disease will progress over 2 years to 10 years. Most patients will die between 2 to 3 years. There are FDA approved medications that help slow the progression of the disease. I'm gonna list those medications in the first comment. However, we always advise the patient to follow up with the neurologist to go through with them with the progression of the disease. So for instance, the patient might have difficulty breathing, so we might assist them with breathing devices. They might have difficulty with the swallowing or eating, so we assist them with these matters too. At times they might have pain, they might have mood changes, so we can help the patient throughout the disease. Now, some patients ask about stem cell therapy. Stem cell therapy has not been proven or effective, unfortunately, to treat this disease. Thank you.